Now back to the urgent manhunt for the killer of the United Healthcare CEO. New video obtained by ABC News shows the suspect waiting for Brian Thompson moments before the shooting. Here's ABC's Rena Roy with the latest from New York.
Today, new video obtained by ABC News shows the suspect wanted for the murder of healthcare CEO Brian Thompson lying in wait. When the killer spots his mark, he runs across the street and opens fire. In newly released photos, the suspect is seen getting into a New York City taxi about 20 minutes after the shooting, appearing to look right at the camera.
We feel comfortable. We're getting closer and closer.
Hundreds of tips are pouring in, thousands of police officers working the case.
I don't want to do anything that's going to tip him off that we're on his trail, but we feel really good where we are.
Again, NYPD divers searching a Central Park pond. They hope to find the gun used in the shooting and the bicycle the suspect got away on. Near the pond, investigators found this backpack linked to the shooter. In it, police sources tell us, a jacket and Monopoly money.
Some kind of statement, some messaging that has to be figured out.
The police also built a timeline starting 10 days before the shooting, November 24th, when they say the suspect arrived in New York by bus just after 10 p.m. He immediately took a taxi to the scene of the crime. He took another taxi to a hostel on the Upper West Side where he checked in using a fake ID and was spotted on a security camera without his mask. On December 4th, police say the suspect is seen leaving the hostel at 5:30 in the morning and arriving near the Hilton 11 minutes later. He was seen walking nearby, ordering at Starbucks, then waiting for Thompson, who crossed 6th Avenue at 6:44 a.m. Today's new video giving us more detail of that. 45 minutes later, police say the suspect was seen at the bus station by the George Washington Bridge, but not seen since. At United Healthcare headquarters in Minnesota this weekend, fencing going up as security is reassessed. Police have not established a motive, but say they found no evidence the killing had anything to do with Thompson's personal life. United Healthcare is declining to answer questions posed by ABC News, including whether the company has offered to contribute to the reward money for information leading to an arrest. Rena Roy, ABC News, New York.
Yeah, man, so they finally caught him. So there's been some we'll not say conspiracy or why he shoot him, because remember he had when it kind of shot him, there was words on the bullet and shot him and everything. And also I want to replay this too, Hakeem. So I found out coming to United Healthcare that when it comes to insurance claims, out of all the insurance, United Healthcare they deny. They have the most denied claims out of all the insurance when it comes to claims and everything. So I want you to play this clip as well. So it's the clip I think it's the last clip I sent you about them having deny more claims. So play the clip after that, we'll chop it up.
United Healthcare denies more claims than other insurers, angering patients and health systems. The bullet casings from the ammunition that killed United Healthcare CEO Brian Thompson reportedly had 3 words written on them, quote, deny, defend, and depose. These words allude to the strategy that some attorneys and critics have used to describe the tactics used by health insurance companies to deny making payment on claims. And the most recent available data suggests that United Healthcare, or UHC, is perhaps the country's worst offender. When it comes to denying claims, multiple reports suggest that UHC, which is the country's largest health insurer and serves some 50 million people, is an industry leader, with a rate nearly double the industry average. A recent Senate report slammed the company for denying nursing care to patients recovering from falls and strokes on its Medicare Advantage plans. And it currently faces a class action lawsuit for its use of AI algorithms to automatically refuse payment. The insurance giant's tactics have frustrated patients and healthcare providers alike. A major protest at the company's subsidiary Optum's headquarters in Minnesota in July attracted roughly 50 demonstrators, 11 of whom were arrested. Disputes with hospital systems over UHC's claim denials have led to some deciding not to accept its insurance at all. Insurance insights firm Value Penguin told Forbes that gauging an exact number of claim denials is tricky, as there's no central repository of this data. But according to one of the firm's reports on insurance claim denial rates, UHC has the highest instance of denials out of all major providers, refusing an estimated 1/3 of claims submitted. The insurer did not respond to a comment request. United Healthcare also has the largest market share of health insurance policies, with roughly $215 billion in revenue. Value Penguin said that based on current insurance plan costs, UHC offers the most expensive premiums in the nation compared to other providers. For example, a middle-tier plan with UHC would cost a 40-year-old person $631 per month, whereas the national average would amount to an estimated $621 per month. The shooting has reignited a national conversation about America's for-profit healthcare sector and many people's inability to afford treatments and medication. Healthcare.gov issuers denied a total of 17% of claims in 2021, with some issuers' denial rates reaching 49%, according to a 2023 report by health researcher KFF. In a 2023 survey of consumers' experience with their health coverage, KFF found that nearly half of adults who had insurance problems were unable to satisfactorily resolve them, with 15% saying they experienced a decline in their health and 28% saying they paid more than they expected. United Healthcare announced a new policy, effective December 1st, by which it may deny charges for inpatient or outpatient services that it considers, quote, routine, which would give the insurer more opportunity to issue denials around specific line items, according to healthcare attorneys at Davis Wright Tremaine. The UHC CEO was shot and killed as he was on his way to a Manhattan investor meeting for parent company United Health Group around 6:45 a.m. last Wednesday. In the hours after, anger and frustration over insurance denials and medical costs bubbled up online and in conversations. One angry poster wrote on X, formerly Twitter, quote, "When you shoot one man in the street, it's murder. When you kill thousands by taking away their ability to get treatment, you're an entrepreneur." Thompson's wife, Paulette, told NBC News last Wednesday that she was aware he had received some threats. She said, quote, "Basically, I don't know, a lack of coverage? I don't know the details. I just know that he said that there were some people that had been threatening him." At the Forbes Healthcare Summit in New York last week, attendee Michael Patton, founder and president of Excel Health Plans, said his initial reaction was that the shooting may have been related to someone whose claim had been denied, given the anger such an experience can cause.
Hey,
As
that's
of
crazy.
this
That's what
reporting,
Hakeem said.
police are still searching for the suspect,
Yep.
and his motivation
Hakeem
remains a
said
matter
that.
of
That was
conjecture.
crazy. I was saying, Hakeem, you been
For full
right.
coverage, check out Amy Feldman and Alex Knapp's piece
It's crazy.
on Forbes.com.
It's crazy. You was right. You literally
This
said
is
it,
Kieran
just like
Meadows
the
from
movie.
Forbes. Thanks for tuning in.
That's crazy.
Yep. Go ahead, Ronnie, man. With this little bit more information, man. What's your take, man?
It's pretty much what Hakeem stated when we first covered Jordan while you was away. He was pretty much just like Hakeem said. He said there was like someone was upset that their coverage got denied and they retaliated, and they did it in a pretty much in broad daylight. People don't care, man. If people coverage get denied, they've been working so hard to remember your medical coverage say, "Hey, I'm able to save someone's life," and then you get denied right after paying all those monthly payments. It can make anybody snap, and I probably snap pretty much. And it's just crazy because I can't say it just like that. And you was right, man. Right on the money, man. Shout out to those watching those on Kick and also Twitch. Go right ahead, Hakeem.
This is a very sad situation, but there's a bigger issue at hand. We've always had a healthcare issue in America. There's people who are unalived by the thousands due to lack of coverage, due to not being able to obtain certain surgeries or medicine to keep that, and they say, "Oh, it's too high." You even got some senior citizens who are on Medicare and stuff like that who are denied, and some are that. And this is why, if a senior citizen doesn't have a family member, or doesn't have somebody to watch after him or maybe financially support, that's an issue. You have to look. We're just tipping the iceberg. Let's talk about the VA and how we have a lot of veterans on the streets who are back. There's a backlog of them finding treatment, and I'm only just speculating. This is all allegedly. And look at Ashay. He says people are unaliving parents, kids, brothers, sisters, mom, dads, and aunties. Go ahead.
Yeah, can you hit right on the money, man? It just shows you in America we definitely have a healthcare problem. You know, a lot of people can't afford to pay insurance, especially and a lot of people like got to pay the premium of insurance, which is very expensive, especially if you have family. You know, for me, I'm lucky. You know, my job they offer insurance. I don't pay a high premium. I don't have to premium. You know, legit. You just be a full time employer. You know, also having my wife and my daughter in my insurance, and we do have really really good insurance and you know, and just have comfort that anything happens to me, my wife, we get sick, anything, we go straight to other care, straight to the hospital, and we won't have to pay so much out of pocket. But when it comes to people who doesn't have that luxury of they have jobs where they work part time or they don't have great insurance, it's devastating to a lot of people, and they get a lot of people crazy. And you see, look, you're not a health clear that when people is paying a high premium and they get denied, that can definitely click somebody's their minds off. It can definitely can drive somebody crazy because you paying what over 150, some 150 a month or 200 a month for some insurances that they got to pay these high premiums, and then hey, I go to get surgery or something, and I get denied or something. We just heard I can't forget what insurance it was that when it comes to certain states, I believe it was New York, Massachusetts, and the third state. When it comes to anesthesia, we're not gonna do that at their insurance. And then a lot of people had a problem with that, and then insurance they roll back and say, hey, okay, maybe we want to cut it off 100% on anesthesia, but we got to pay some type of co-pay on that. So yeah, man, it's coming looking like a law. It's like you see other countries, like Canada, they got free healthcare, and there's a lot of other countries that have free healthcare, and then there's a lot of countries that a lot of people don't know that America is paying some of these countries so they can have free healthcare as well. But when it comes to here in the United States of America, you gotta pay for healthcare. Either you're not gonna get any health or you might be on the other side. And when it comes to this healthcare system, it does need to be fixed. With better healthcare, and see if we can see not discount but a low payment healthcare when it comes to these premiums, because there's a lot of these health insurances. Their premium is very very high, and a lot of people cannot afford to pay these premium high per month when it comes to these health insurance and everything. So yeah, when it comes to health insurance, we definitely need to be fixed. Even the you don't have to go high as federal. If each state, governors can find a way to fix this medical insurance and some things like that, it can be doing that. So I'm not gonna blame federal on this. It's not just federal. It's a federal thing that needs to it needs to be addressed. And also, when it comes to states and governors and local officials, we need to find a way to make healthcare more affordable. Because as also you can see that after the CEO got shot and got deleted, you saw a lot of these insurances. They took all these CEOs off these websites and everything because of the situation. And hey, healthcare is something out there, It needs to be addressed because we must if we see more players be denied, people paying premium. Hey man, we might see more. Hopefully, we won't see other CEOs, but we might see another thing happen like this as well.
Yeah, that's facts upon facts, man. Shout out to those right now that's watching us on X, also watching us on Rumble, Kick, and also Twitch, guys. Make sure you follow. It's so very important that you guys follow so you never miss when we go live. Shout out to those watching us on Instagram, Facebook. Thank you guys once again. YouTube, we love you guys so much for always tuning in when we go live. Yeah, but